Okay, Yulika, so you have 12 o'clock meds due
Yes.
now.
Mhm.
Okay,
Yeah.
perfect. And how are you feeling about giving meds?
I think pretty okay. I researched, my patient yesterday. I did look up all of their meds, and I do have the little
Okay.
cheat sheet that I completed. So I
Perfect.
think I feel pretty okay with
Okay.
knowing what they are and why he's
Okay.
taking them.
And have you re-looked at things this morning? I know you looked at it last
did.
night. You did?
I
Okay.
did, yeah. It doesn't seem like there were any changes
Changes.
overnight, so it looks like the same meds are due at noon
Okay.
that were due yesterday.
Perfect. Okay. So before we go into the room, how about let's go try to find one of the wows and let's look at these together.
Okay.
That way, when you go in the room, you feel a little bit more confident about what you're giving in case the patient asks questions.
Okay.
Okay.
Yeah, sounds
Okay.
good.
Let's see. Let's look over here.
Okay,
Yes.
sounds good.
Okay. So we can use this wow here.
Okay.
I'll sign us in. Okay. Perfect. So you can go to Epic. Yep. And let's see, just if you want to grab your med sheet.
Okay.
So how many medications do we have for 12 o'clock?
So about 12 o'clock we have 1, 2, 3, 4, 5, 6.
Okay, perfect.
Yeah.
All right.
So the first one I have Docuset, which is a Colace. It's just a stool softener laxative. That's given by mouth, 100 milligrams.
Good. And real quick before we get to that, give me
Yeah.
just a one sentence synopsis
Oh,
of
yeah,
why
for the
your patient's
patient.
here.
So the patient, they're 76-year-old. They were admitted for left hip arthroplasty, and it was complicated by C. diff infection, and they also developed an infection in the joint, in the actual joint after the surgery.
Exactly.
Yeah.
Good. Perfect. Okay.
Yeah.
So you were saying the Colace, and
Colace.
that's that looks like that's once a day at 12 o'clock.
Yeah.
PO, and you said that's a stool softener. And why is he taking that?
Just because I feel like anybody who's in the hospital, and he also has limited mobility because he just had a hip surgery, so it's very easy to get constipated. So it's often given to prevent constipation.
Exactly. Good. And let's just take a quick look at his eyes and nose from last night. So what did you notice about his output overnight?
So overnight he put out 800 of urine, and then it says that he put out like over a liter of liquid. He had like 5 liquid bowel movements.
Yeah.
So he probably shouldn't be getting that.
Exactly. Yes, and we know he's here for C. diff,
Yes,
right? So,
yes.
So this is a great example of just because the medication is ordered
Right.
and it was, put in by the provider, approved by the pharmacist, we don't always give meds, right? So we
right.
want to sort of think about, like, does our patient really need this right now? So
Yeah,
that's
so he
something that we'll
wouldn't.
do not give in, and we can put in the comments or, choose the drop-down menu that it's contraindicated due to all of the bowel movements.
Okay. Yeah. So I won't pull that one.
Good.
So the next one, he just gets his regular insulin per sliding scale.
Yep.
And that's given with meals.
Yep.
And we just checked his blood sugar. It was 160.
Yep. 160. Yep.
And his lunch should be here any minute because he ordered like over an hour ago.
Yep.
So he should be getting.
How many units for a blood sugar of 160?
So it says 152, 199. It would be 2 units.
2 units.
For that.
Yep.
for
Perfect.
That.
And how are we going to give that? What's
So that's the sub-Q injection.
Yes, very nice. And major side effects you'd be looking at here?
So I know the big one is the lipodystrophy because, especially if you don't rotate sites of infection, nausea, you can have pain just of the site, and then hypoglycemia.
Okay.
I think those are the ones that I.
Good. And out of all of those, which one do you think is the most important? Because you've probably already realized there's tons of side effects for every med, right? But what really are you going to kind of focus on here?
I mean, he gets the insulin multiple times a day and probably for a long time because he has a history of type 2 diabetes. So probably lipodystrophy just because he gets so many injections all the time.
Okay.
So
that's definitely important to monitor those sites, right, and rotating those sites. But what do you think is a little bit more important, sort of when we think about, that critical thinking?
I mean, Nausea could be because he's already losing fluids through his stool. So now if he starts to vomit, he's going to lose fluids more. So he can become dehydrated.
Okay, that's good. But let's say we give that insulin. We know that regular insulin is short acting. So let's say he vomits, right?
Yeah.
What's something more important that you're going to be looking for now that you've given a short acting insulin?
So hypoglycemia. Because if he vomits, he's not going to get his sugar in.
Exactly.
So he'll develop hypoglycemia, and that can be life-threatening.
Exactly.
Right.
So you want to think more sort of like ABCs, right?
Yeah.
Beyond that. And so anytime with your insulins, you're looking at that, you know, those signs and symptoms of hypoglycemia.
Okay.
Good. Okay.
Then he gets the metoprolol. So I know this is a beta blocker.
Good. Very nice.
12.5 milligrams. It's also by mouth.
Yep. And how many times a day?
That's also given twice a day.
Okay.
And so
that due now.
Yeah, it's due now. And that's given for high blood pressure.
Okay.
And I would be monitoring. I have written like rash, shortness of breath, dizziness, and bradycardia.
Okay.
But I think from all of these, I think that, again, just kind of like insulin lowers your blood sugar, beta blocker lowers your heart rate. So I feel like that could be something most important to monitor because heart rate can develop, cause low blood pressure.
Exactly.
And then the patient can faint and fall.
Exactly. Very nice. And so what are you going to check before, besides the heart rate? What else are you going to check before you give that beta blocker?
So heart rate and blood pressure.
Yes, very nice.
Yeah.
And we'll look at the parameters. So it looks like on the parameters, we're going to hold it if the heart rate's less than
60. And blood pressure for systolic less than 100.
Exactly. Very nice. Good.
And then the next two medications that I have are both antibiotics, and it's actually the same antibiotic.
Okay.
So he gets vancomycin. One is giving PO, 125 milligrams, and then the other one is giving IV, and that's 1,500 milligrams.
Exactly.
And those are giving for his joint, I'm guessing his joint infection, because it's an antibiotic, so that's, yeah.
Okay, good. So you have the vancomycin, 125 milligrams PO, and that's given 4 times a day. So we're due now at 12.
Yes.
And then you have the 1,500 milligrams IV.
Yeah.
That's twice a day due now. But even though it's the same medication, they're actually for 2 different reasons here. So you're right about the joint infection for the IV Vanco. But what are you thinking for that PO, that dose of 125 milligrams?
I mean,
what else? Look at what you have written.
Oh yeah, so he also has that C. diff infection. So, so that's giving for the C. diff infection because it's PO, so it directly goes into his GI system.
Exactly. Okay. Very nice. Yeah. Perfect. And we'll look up the policy about, you know, the pump will also let us know, but it's always good to double check. So does he have a peripheral or central line?
He has 3 peripherals.
Peripherals, okay. So that's important to know because whether it's a peripheral or central is really changes how quickly it can go in. So we will look up the policy to see, compare it to the pump.
Okay.
Okay. All right, and then lastly, you have a PRN dose of that Dilaudid, so we'll assess his pain. We'll see if we need it. But really quick, what's your big nursing implication for Dilaudid? What are you going to look at?
For Dilaudid, so I know it can cause you to have like lower blood pressure, and then we also have to make sure that we check his pain level, that it's like high enough for Dilaudid, but then also respiratory depression.
Exactly. So we want to get that respiratory rate and really monitor that, make sure that that's at a good level before we give that.
Yeah.
But we'll assess his pain. It doesn't look like he's gotten it over the past 24 hours, but you know, we don't, maybe things have changed. So.
Yeah.
Okay. All right. Well, let's go to the Omnicell, and I will be with you, and you can pull all of those out, and that way you're confident before going into the room.
Okay. Sounds
all
good.
Right.
Thank you.